Good day, everyone. I am Yna Denolan, a BSN 1B student, and for today I will be doing the nose, mouth, and sinuses assessment. Prior to this assessment, all of the materials needed should be gathered and complete. And before and after this assessment, I will do proper medical hand washing. Here are the materials needed for today's assessment. We have our gloves, we have our pen light, we have our tongue blade, we have our sterile gauze, we have our stethoscope, we have our makeshift otoscope with our magnifying glass and pen light, we have a drinkable cup of water for the client to sip in our assessment. I will further disinfect my hands with alcohol and don my gloves to start the assessment. So now we are ready to start the nose, mouth, and sinuses assessment. But first, let us maintain privacy to the patient, have proper ventilation, and introduce ourselves and this procedure to the client to also have their consent. So good morning, sir. I am Yna Denolan, your nurse for today. May I know your name, sir?
Juben Jan Piparon,
So good morning, sir Jubin. May I know your age?
11 years old.
11 years old. So thank you. So for today, we will be assessing or inspecting your nose, mouth, and sinuses. So I will be touching your face. I will be palpating it gently. And then we will be assessing if you have any lesions, edema or swelling, or any discolorations, tenderness, sensitivity to pain, or any abnormalities. So we will know that today. So are you okay to participate with me?
Yes.
Okay, thank you. So now we will proceed to inspecting the frontal sinuses. We will use our pen light in illuminating the frontal sinuses here. As you can see, both frontal sinuses have a red glow. And for better visualization, I will use this flashlight. Okay. So it is normal. It indicates normal air-filled sinuses. And now we will move to the maxillary sinuses. We will shine a light just below the eyes. As you can see here, has red glow for both maxillary sinuses. For better visualization, we will use our flashlight here. So both are normal. And we will now proceed to palpating the frontal and maxillary sinuses. So I will start here. Just tell me if sakit. Here, frontal sinuses. Dire, sakit.
Dili.
How about here, the maxillary sinuses? Dire, dili ra?
Dili ra.
Okay, and now we will proceed to percussing both the frontal and maxillary sinuses. So tell me, dire,
Dili ra.
dire,
Dili ra sakit.
dire,
Dili.
dire.
Dili ra.
Okay, again.
Dili ra. Dili ra. Dili ra. Dili ra.
Okay, so both the frontal and maxillary sinuses are normal. Next, we will proceed to inspecting and assessing the nose. So we will note for the position, color, and discharges. So as you can see here, the position of the nose is in the center and it is symmetrical. The color is the same as the rest of the face of the client. And for discharges, we will use our pen light. There is none. And now, we will inspect the nasal mucosa of the client. So, can you tilt your head for me? Okay, thank you. So, I will use my magnifying glass as my makeshift otoscope or nasoscope and will shine the pen light. So, okay. For better visualization also. Okay, another move here. As you can see, the nasal mucosa is pink, has a color pink, it's moist, and there is even distribution of hair. And the turbinates are also pink. So the turbinates are the ones who moisten and warms the air when it goes inside our nose. So for better visualization, we move to this point of view here. As I shine a light here, you can see the nasal mucosa, the patient or the client, and it is pink in color. The turbinates are also pink in color, and the hair distribution is also normal. There are no debris or discharges, and it is all normal. Now let's proceed in palpating the patency of both nares. So tell me if sakit ha. So let's start with the right.
Dili ra.
So left.
Dili ra.
Okay, so we can also run a test in which the client can cover one side and breathe to it. So we can test the integrity, the strength of the nasal wall. So can you cover first your left? We will test the right. So can you breathe for me? Dili ra riso di ginhawa.
Dili ra.
Okay, so as you can see earlier, there was no collapse, so it is good. Now we move to the left. So can you cover your right? Dili ra riso di ginhawa.
Dili ra.
So as you can see, there was no collapsing of the nasal wall. So both the nares are patent and are normal. Next, we move in inspecting the lips for its color, condition, lesions, or if there is a foul odor. So for better visualization, I will use my magnifying glass. Okay, so as you can see here, the lips for its color is pink, and we inspect for the anterior and posterior part. So we can also see the condition. It is smooth, the color is pink, there are no lesions, it is not cracked, and there is no foul odor. So in which we will also open to assess the anterior part. It's also pink. The posterior part is also pink, and again, there is no foul odor. So it is normal. Next, we move in assessing the teeth and bite of the client. So, can you open your mouth for me? Close it. Again, open it. Okay, wide. Okay, thank you. So, we count the number of teeth. So, it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. So, it is 25. And he is lacking a tooth here. Can you smile for me? Smile. Open teeth here. Smile. Pakita, tango. Ana. So, he is lacking a teeth here. So, bago pa ni nabunot, nakuha.
Dugay na.
Hapit na. Hapit na pod mo tubo. Gamay pa. So, for the color, it is also normal, ranging from whitish to yellowish for the color. And it is normal. We can also move to another point of view in having for the better visualization of the teeth of the client. Can you open your mouth for me? Okay, very good. So that, kana, open wide. So we can see here his teeth. There are small manifestations of tooth decay. So, can you open it wide? Okay, for better visualization, let us use our magnifying glass. Shine a light through it. Exterior part. Here. So, as I've said earlier, he has 25 number of teeth. And the color is ranging from whitish to yellowish. And we will use our tongue blade in this portion. As I've said earlier, that he is missing one tooth here. It is still growing. Okay. Now let us move in assessing the oral mucosa and the gums. So we will now use our tongue blade and our pen light to assess. Can you open your mouth for me? Okay, big and wide. So here, you can see the oral mucosa is pink, no lesions or swelling, sign of edema. It is pink and smooth. And for the gums here, it is also pink. Can further use our hands. Okay. Here, the gums, it's pink. And we can move to another perspective in viewing the oral mucosa and the gums. So can you open your mouth for me? Nice and wide. Okay, very good. So here we inspect again the oral mucosa. It is pink in color. Open wide. Okay, there are no lesions, swelling or edema present. The gums are healthy and pink. So there. For the oral mucosa and the gums, it is pink in color, moist and smooth. It is all normal and healthy. Next, let us move in inspecting the hard and soft palate. So we will shine again a light or pen light to the mouth of the client and assess the hard and soft palate. But first, I will offer the water for the client. Okay, basig nang malana or naunsa. Okay na? Okay ra?
Kira.
Okay, so now let's proceed. So, can you open your mouth for me again? Okay, very good. So here, the hard and soft palate is both pink. We can use our tongue blade here to test for tenderness. Dili ra sakit? Okay, dili ra. So it is pink in color. There are no signs of tenderness, no swelling or edema or lesions present. So it is smooth and healthy. Now we move to another perspective in assessing the hard and soft palate. So can you open your mouth for me? Again, okay, nice and wide. So here we can see that the hard and the soft palate is smooth Color pink, no lesions, swelling, or edema. So, let us assess for tenderness. Sakit? Dili ra. So, it is all normal. So, you can close your mouth na. Okay, thank you. Next, we will proceed in assessing the salivary gland. So, in this portion, we will again use our pen light in illuminating the inner portion of the cheeks. Another tongue blade to practice good hygiene. So, can you open your mouth for me? Okay, very good. Nice and wide. So, here, for the inner portion of the cheeks, it is color pink. No lesions or signs of edema or swelling. No abnormalities. We assess and inspect for the Stenson gland here. So there is the Stenson gland. Also here. Okay, so we retract it. Assess for tenderness. Sakit dili.
Dili.
Okay. And now we move to the Wharton's duct just below the tongue. So, up your tongue. Okay, very good. So, here is the Wharton's duct. It is also pink in color. So, the dorsal part of the tongue is healthy. We can see here the veins. The color is pink. No edema, swelling, or redness. And it is all healthy. So you can close your mouth. We can also move to another aspect or position of the camera so we can have a better visualization. And again, your mouth for me. Open wide. Thank you. There. So we will shine our pen light here and assess the inner portions of the cheek. Retract with our tongue blade. There you can see that it is pink. Both sides. Can you face here? Open again. Okay, very good. So both sides are pink in color. We assess for the Stenson gland here. Open wide. Okay, very good. So there is the Stenson gland. For this portion, the left side, the right side is okay also, and the left side is okay. So as you can see, there are no lesions, swelling or edema, redness even. There's none. So we can also test for tenderness. Dili ra sakit.
Dili ra.
Okay, next we assess for the Wharton's duct. Tongue up. Okay. Very good. So here we can see the Wharton's duct, the veins of the dorsal part of the tongue. It is also pink in color, healthy, no lesions, swelling or edema present, and it is all normal. So you can close your mouth now. Thank you. So in this portion, we continue in inspecting the tongue. So can you open your mouth for me? Protrude your tongue, ipagawas. Okay, as you can see here, we also note for the color, texture, and moisture of the tongue. Just stay like that. Okay. Here, the color is pink. For moisture, it is moist. And for its texture, it is a little rough. And it is healthy. So, can you move your tongue? Don't bite it. Ana? Very good. Okay. So, again, the moisture, it is moist and normal. For the color, it is pink. And it has a little rough texture. So, can you move your tongue? Can you move your tongue? Up, down. Okay. So, it is normal. Next, we assess for the oropharynx for its color, lesion, and drainage. So, we will use our pen light. So, can you open your mouth for me? Okay, protrude tongue, gamay. Okay, here. So, for the oropharynx, for its color, it is pink. There are no lesions. Open mouth wide. And the drainage is normal. It is moist. And it is healthy in color. You can see here, the oropharynx is pink in color. There are no lesions, swelling, signs of edema. There are none. And for the drainage, it is normal. No abnormalities. And it is moist. Okay, thank you. Let us now proceed in inspecting the tonsils for its color, size, and exudate. So, can you open your mouth for me? Okay. Open your mouth wide. Use our pen light. Relax the tongue. Relax. Pwede ipagawas gamay ang tongue. Okay. So, Okay, there I can see the tonsils. And it is posterior in the arches, the sides. And it is normal, so you can close your mouth now. So it is posterior to the arches of the throat, and in the tonsil grading scale, I would rate it grade 1. It is normal. The color is pink. The size is small, and it has no exudates. Now we move in inspecting the uvula of the client. So, can you open your mouth for me again? Okay. So, I will shine a light to see the symmetrical rise of the uvula. So, you can say ah. Okay, there. So, there is a symmetrical rise. Again, can you say ah? Okay, there is a symmetrical rise of the uvula and it is normal. So we can move to another aspect for better visualization. Can you open your mouth for me? Okay, very good. Relax the tongue. Okay, so can you say ah? Again, There you can see the symmetrical rise of the uvula. So close your mouth now. Thank you. Let us now move to inspecting the lips for its consistency and tenderness. So I will inspect first the external part and palpate it. Sakit, dili?
Dili ra.
Dili. Dire?
Dili ra.
Okay, so it is consistent. There are no signs of tenderness. And we inspect the inner portion now. Here, dili ra?
Dili ra.
How about here? Dili ra?
Dili ra.
So it is normal. No lesions, swelling, or edema, and it is smooth and normal. Now let us palpate the tongue of the client for its tenderness and consistency. So I will use a clean gauze here and holding the tongue. So can you open your mouth? Okay, protrude the tongue. There. Dili ra sakit? Okay. So it is pink in color. It is consistent. No sign of tenderness, swelling, or edema. It is all normal. So there. Next, we palpate for the glands. First, we palpate for the parotid glands here. Sakit, dili.
Dili ra.
So we palpate it bilaterally. And next, the submandibular glands, dire.
Dili ra.
Okay, dire the sublingual glands.
Dili ra.
Okay, so it is all normal for the glands. So lastly, we will perform the gag reflex. We will test the gag reflex of the client. So I will use another tongue blade, a clean tongue blade. So can you open your mouth for me? I will stimulate it by the posterior aspect of the oral cavity of the client. So open your mouth. Okay, so it is all normal. So very good. So I will now document all your findings. And Sir Jubin, for your age, 11 years old, it is all normal. Continue to eat healthy. Always brush your teeth and listen well to your parents, okay? So thank you for today's participation. Thank you so much, sir.
Thank you.
Okay, so now we are done with the nose, mouth, and sinuses assessment. And I will discard my gloves properly and throw it in the receptacle bin together with the tongue blade and the gauze that is used. And I will perform proper medical hand washing after this. That is all for today. Thank you and Godspeed.